Let's know more about cataract from the experts.
Welcome to our podcast on cataract surgery, procedure and recovery. I'm Dr. Ridhima Bhagali, Director of Pioneer Medilaser Clinic in Pune. So today we're going to start discussing what a patient undergoes when he plans to get a cataract surgery done. One needs a cataract surgery when their vision is getting cloudy or experiencing nighttime glare. Once you've consulted with your doctor and decided on getting a cataract surgery done, what is the preparation that goes in before undergoing the surgery? The first is we need to start putting some preoperative antibiotic eye drops in the eye that is to be operated at least a day before the surgery. On the morning of the surgery, you have to have a light meal. Take whatever regular medicines that you may be taking for hypertension. You should have taken a head bath well before so that you can do without putting water in your eyes for the next couple of days, usually a week's time. Any eye makeup that you're using needs to be removed thoroughly before you go in for the surgery. You have to go in for surgery with an attender. Once you reach the clinic, you will be handed over a consent form that needs to be read carefully and discussed if you have any queries before signing it. Once you reach the clinic, the eye that is to be operated upon will be dilated by the attenders in the clinic, and then some numbing drops are used in the eye so that you do not feel any pain sensation. Once you're properly prepared, you will be given an appropriate attire, a cap, and mostly a gown, or you may need to change clothes into the operation theater clothes and taken inside the theater. For the cataract surgery, you will have to lie down, and a couple of monitors will be placed to check your blood pressure and your pulse and oxygenation in your blood level. There will be a standby anesthetist, though usually for cataract surgery, topical anesthesia is used. That means mostly nowadays a peribulbar block or a needle is not used, just some numbing eye drops are used. The eye that's going to be operated upon is then cleaned with some betadine solution and properly draped to maintain a sterile environment for the surgery. Your eye is kept open during the entire procedure, so you don't have to worry about blinking it. But throughout the procedure, you will see a very bright light. There's a microscope over your eye that helps the surgeon see your eye better and magnified. So you have to keep looking at that light and you'll see different colors and lights and hear different sounds, because usually cataract surgery is done by a method called phacoemulsification. That means a tiny instrument, a pen kind of instrument, is put inside the eye to crush and suck out your cataract. So you may be hearing the sounds of the machine and a lot of water, like your eyes being washed throughout the procedure. A regular cataract surgery usually takes about 10 minutes time. And after this time, you are given some dark glasses or transparent glasses, but protective ones, so that you do not keep taking your hands up to your eyes. If an injection is given at the time of surgery, then your eye is kind of paralyzed, and then a patch needs to be put over the eye. That may be put for half a day or an entire day, depending on what your surgeon decides to do. After which time, once you walk out of the theater, which could take like about 10-15 minutes time, you are instructed in detail about your post-op care, about what kind of drops you need to put. And usually the care is that you have to protect your eye from any kind of infection. So you have to avoid water, soap, wind, dust, crowded places, anything from entering your eye. Even your own hand carries germs, and you have to protect your eye from wiping it, dabbing it. That urge has to be resisted for at least 8-10 days. You have to take care. And there are quite a few post-operative eye drops that you need to put, the frequency of which keeps on reducing as the days and weeks go by. But usually over a month's time, they would have tapered and stopped. All your routine work can usually resume a week later, and any strenuous work maybe 15 days later, like exercising and stuff. And there are a couple of post-operative follow-ups that you need to keep up with your doctor, like the day after the surgery, usually a week after, and a month after, during which time he will prescribe any glasses that are required. So if you're considering cataract surgery, consult with your eye doctor to determine the best approach. Take care of your vision and stay healthy. Thank you very much.
Act early, prevent early. Driving change to defeat cataract.